find one of the hardest things with these young cases is that the sclera is so difficult to close. That trapdoor, you're putting in your two releasables. You had two in the back lip of the scleral flap, and sometimes you even have to put two in the sides, and you cover that nicely because you don't cut the sides all the way to the limbus. But just in case you do, sometimes you have to put sutures even in the sides just to get some sort of control of that anterior chamber.
Oh, absolutely right, Graham. And in fact, one of the modifications I've made to my technique, probably in the last 2 years, is you don't read about this much, but in certain types of eyes, such as very high myopes, juvenile open-angle glaucoma, vitrectomized eyes, you get a form of scleral collapse when you enter the eye because the vitreous is often just fluid. And so once the eye is open, it's actually very hard to maintain good pressurization of the eye, even sometimes with a Lewinsky infusion in place. And I've now started to pre-place the interrupted sutures as well as the releasable ones because they're so hard to put in on a soft eye. And so, the sutures at the back edge of the scleral flap are relatively easy to put in, aren't they? But the sutures on the side of a scleral flap are tremendously difficult to put in. But if you put them in on a firm eye before you open the eye, actually it's really easy. But you've just got lots of string around, so you've got to be careful that you put it in all the right places so that you don't get it mixed up. But I found that so helpful, in, say, a 25-year-old highly myopic JOAG case, to actually pre-place sutures in the side of the scleral flap, interrupted sutures, and then you can tie them rapidly and easily post-op.
Yeah, I've got another technique where I can put them in as buried releasables as well, and I
Yes,
think I've
that's a
showed
great
that.
technique. Yeah, I like that technique as well. I think that's a great technique.
I can still remember Eamon O'Neill describing the scleral closure as nylon toxicity, and yeah, I suppose. Yeah, but previously that they may not have used so much suture to close these cases, but it's all about control and adjustability as well. So you want to be able to have absolute command over the flow through that scleral flap. If you enjoyed this lecture so far, please subscribe to http://iop.vision. I hope you enjoyed this series as much as we have putting it together. Thank you.